Today I will be discussing long-term supports and services and how the program provides services to older adults and individuals with disabilities. Prior to conducting a literature review, I posed a few questions to provide a direction in my research. So I decided to narrow my questions to the following. Is the current LTSS system sustainable? And is the current system providing the targeted population with the appropriate and adequate health care services? States are given the option to participate in the Medicaid program. They must develop a state plan that includes the services offered, the intended target population, mandatory services for LTSS, and home health. State plans must be approved by Medicaid. These services are considered entitlements and are offered to Medicaid beneficiaries that meet eligibility criteria. Medicaid authorizes a number of waivers that waive certain requirements for states to provide certain services and specific populations using that service. There are two waivers that states utilize when providing community-based services: demonstration waivers and home and community-based service waivers. The Section 1115 demonstration's purpose is to provide services not provided under Medicaid and using innovative delivery systems that will improve care, reduce costs, and improve efficiency. Demonstration programs can be approved for up to 5 years and can be renewed for an additional 3 years. The Affordable Care Act expanded the Section 1115 demonstration programs to include the examination of dual eligible projects and that both examine both Medicare and Medicaid. The 1915B waiver is composed of 4 different types of waivers that allow states to operate services such as managed care models under Medicaid. The 1915C Home and Community-Based Waiver allows states to provide long-term care programs and services in the community setting. These programs can include standard medical and non-medical services, such as case management, home health aides, and respite care. The Community First Choice Waiver, or 1915K waivers, provide home and community-based attendance services to individuals with disabilities under their state plan. The waiver allows attendants to help individuals with ADLs and IADLs, health-related tasks, and enhancing the individual's skills to perform the task. The 1915I waiver allows Medicaid beneficiaries to receive acute care and long-term care services if deemed eligible for the services. States are responsible for targeting a specific population that it intends to treat under the waiver. Once the population is specified, the states must develop home and community-based services that meets the needs of a specific population. The Self-Directed Personal Assistance Service Waiver provides the beneficiaries the option to choose their own providers for personal care services. Beneficiaries under this waiver are given the opportunity to manage their own services and can be responsible for paying for these services. Beneficiaries are also free to self-direct their own health care so that they can determine who is involved in their care and lead the direction of their care. Long-term supports and services is a broad range of supportive services that are offered to individuals that need help with self-care due to physical, developmental, cognitive, or mental disability. An individual's need is determined by functional status and the ability to perform activities of daily living rather than age or medical diagnosis. The majority of beneficiaries age 65 and older while remaining in the population. In the additional population, there are adults ages 18 to 64. In 2012, LTSS spending was 9.3% of all personal health care spending. The Older Americans Act grants federal funding to states that offer a variety of community-based services to older adults aged 60 and older. Community-based services include nutrition programs, homemaker services, and adult daycare services. Title III of the Older Americans Act provides supportive services, nutrition, family caregiver support, disease prevention, and health promotion. The Americans with Disabilities Act prohibits states from excluding or denying benefits or services for individuals with disabilities based on the basis of disability. The ADA was modeled after Section 504 of the Rehabilitation Act of 1973, which provides protections for individuals with disabilities against discrimination based on disability. The key components of LTSS consist of access to public LTSS programs, availability and support for consumer-directed services, workforce development, support for family caregivers, and transitioning residents from institutional settings to the community, and diversion from institutional placement. So, beneficiaries that enter the LTSS program attend option counseling from their local Aging and Disability Resource Center, or ADRC. Each ADRC serves as a single entry point for beneficiaries to understand the available LTSS programs offered within their geographical location. The Affordable Care Act requires states to adopt the single entry point or no wrong door approach. Under availability and support for consumer-directed services, consumer direction allows the consumer to have the authority to control service budgets and the ability to control direct care staff members during the enrollment of their program. Under workforce development, there's a lack of federal requirements for training and certification of direct care workers. This includes low wages, high turnover, and no benefits. Developing a career ladder for direct care staff members will encourage entry-level staff to remain in the position for the long term. Under support for family caregivers provide the majority of care for older adults and individuals with disabilities to remain in the community. Providing supportive services for caregivers is important and allows caregivers to continue providing care to relatives. Long-term supports and services offers paid caregivers to assist informal caregivers in completing health tasks. The Department of Veteran Affairs offers a comprehensive package for informal caregivers. The primary caregiver is given a monthly stipend and is reimbursed for care-related expenses. In addition, the primary caregiver is given access to health care insurance, caregiver training, and mental health services and counseling. Transitional approaches focuses on methods for transitioning residents back to the community from the hospital or facility. The Money Follows the Program demonstration participants are provided care coordination, technological assistance, and personal assistance for up to 1 year after transitioning back into the community. The Deficit Reduction Act of 2005 aims to reduce federal entitlement reductions in 2 separate phases. It provides additional spending for HCBS programs for older adults and individuals with disabilities where states are given the option to offer the services as an optional benefit rather than applying through a waiver. Managed LTSS has become a popular method for states to reduce costs and create a singular system to avoid costs. The state scorecard has been published for 2011 and 2014 and ranks the 50 states based on performance among 5 dimensions: affordability and access, choice of setting and providers, quality of life and quality of care, support for family caregivers and effective transitions. The 5 dimensions are comprised of 26 baseline indicators that measure states' performance compared to a high-performing LTSS system. The states were ranked within 4 quartiles based on their scores. The highest performing states were Minnesota, Washington, Oregon, Colorado, and Alaska. The lower performing states were located within the southeast, and the bottom states included Tennessee, Mississippi, Alabama, and Kentucky. Some of the major findings were that the cost of LTSS were not affordable for middle-class individuals. Only 10% of older adults have long-term care insurance, so the remainder of the population must depend on Medicaid to pay for the long-term care services. All states had a lack of consumer choice present in their current system. High-performing states generally scored higher for effective transitions and choice and quality. These states were more likely to return nursing home residents to the community setting with minimum disruptions. The current LTSS system is fragmented and is seen as an option service to older adults that can vary by state, disability, and age. Therefore, the LTSS programs are not accessible to all Medicaid beneficiaries, even if they are eligible for services. So my recommendations include to educate and train the current direct service workforce, and this includes higher wages, adding full benefits, and including career development. LTSS should become a mandatory program for all Medicaid beneficiaries. We should also increase caregiver support to include benefits such as the VA's program. In addition, we need to increase affordable housing options for older adults to remain in the community. One of the biggest issues is that housing has become unaffordable for most older adults, especially those who are listed under Medicaid. We must increase awareness for long-term care insurance and affordability so that way older adults do have the ability to afford long-term care. And we need to develop federal guidelines for established LTSS system performance.